session we will discuss about how exactly you should perform in the P drug selection exercise, which is commonly asked in pharmacology practical, so you can get the best result. Okay, so there is a one question exercise which is asked like this: select the P drug for the given condition. You have been given a particular condition and you have to select the P drug for that. Okay, and there will be viva on that. You will be provided 30 to 45 minutes for this exercise depending on the university. Now, so there are two parts. First thing is about you have been given the time 30 to 45 minutes. For that you have to prepare a write-up for the selection of the P drug and you have to give the viva. Now what exactly in the write-up you have to write for the selection of P drug? So there is a one confusion that whether you have to write the derivation of the P drug or you have to just write your selected P drug. And the answer is you don't have to just write your P drug, but you have to actually write the process of derivation or selection of the P drug. Okay. Now, so how will you derive the P drug? The derivation of the P drug, the WHO has given the steps for the selection of the P drug. And first and the foremost step is identify the problem or mention the diagnosis. Then depending on the problem, what are your treatment objectives? Say for example, the symptomatic relief or to cure the disease or both symptomatic relief, cure of the disease, prevention of the recurrence, prevent the development of the complications, so on and so forth. After that, to achieve or to fulfill these objectives, you have to make the inventory of drug groups. Which drug groups they are effective, and amidst different drug groups, which drug group you will select, and after selection of the drug group, which drug you are going to select. Fine. And lastly, you have to write the prescription. Now, selection of the drug group and the selection of the drug, you have to follow certain criteria. And first and foremost, it is very obvious that whether the drug is effective or not. After the effectiveness, the next question is whether the drug is safe or not. Then, suitability, whether the drug is suitable for a patient or not. And lastly, the cost. Based on these four parameters, you have to select the drug group and you have to select the drug. And majority of the students, they are forgetting the last but the very important step is you have to write the prescription also. Fine. Now, next is which are the commonly asked questions in viva. First and foremost, what do you mean by the P drug? You don't have to just stop over there that it is a personal drug for prescribers. Now, you have to elaborate it further, explain the concept of the P drug. Because if you just go through the steps of the P drug, physician or the prescriber has to follow these steps for the selection of the P drug for each and every condition. And after following these steps, he or she has to select a particular drug for a particular condition. Okay, because the suitability for the different patient is different, suitability in the different environment is different, cost is also a criteria for the different population, essential medicine list is also different for different communities. There is a variation, and because of this, there is an inter-individual variability. But if one has followed. The WHO has laid down this concept is because of one has to follow this criteria for the selection of the key drug. So the drugs for a particular condition, one should be very familiar with the his or her selected key drug. Okay. Then which are the steps for the selection of the key drug? We have already discussed. Then what are your treatment objectives in the given case? Now again there are two parts. One is you should know the basic about the P drug, and second is P drug in relation to the condition that has been given to you. So in the given condition, it is very obvious that if the condition is given, that is your identify the problem. But the next is define your treatment objectives. Here you have to write the treatment objectives, you have to justify them, and based on that you have to make the inventory of the drug groups. Now again the commonly asked question, which parameters you will consider while selecting the drug group for the drug? And these are efficacy, safety, suitability and cost. Now the next step is for selection of the drug group, which parameter you will prioritize. It means that which is the first parameter you will give the priority, that is efficacy. Drug must be effective, followed by the drug must be safe, and the third is suitability, whether the drug is available, that is one. Second, the dosage form of the drug. Okay, you have to explain to the patient that are you convenient with this dosage form, because this is important, especially for the chronic condition for the patient compliance. If the patient is not happy with the parenteral route, you have to select some other drug which is given by the oral route, if it is available. Then the frequency of the administration. Obviously, if the frequency of administration is less, patient compliance will be better. So suitability in terms of improving the patient compliance and the availability. Okay, these you have to explain in detail. And lastly, the cost. Okay. So how will you evaluate the suitability criteria? So these are the basic questions that is going to be asked in your drug selection, certain general questions, certain your condition related question. So this is all about the drug selection exercise, and in the next session we will discuss about the FDC, it means the fixed dose combination evaluation